And let's start tonight with the growing concern over a dramatic rise in coronavirus cases in Arizona. Our state adding 618 more cases just in the last 28 hours. That brings the state's total now to more than 28,000. The death toll also up to 1,070. And at the same time, we're seeing a record number of Arizonans showing up at the ER. For the fourth time in a week, Arizona's emergency room seeing a record high in patients, 848 people turning up just yesterday. So tonight we're asking, what is the plan as our state breaks its own records for hospitalizations? ABC 15's Nicole Grigg finding out it's not just the data going up. Nicole?
It's a data point that was a primary driver for Governor Ducey to reopen Arizona. The CLI surveillance data, it has gone up 2 weeks straight now.
Is Arizona still following the science?
Well, as I said before, our numbers do continue to go up.
We asked State Representative Amish Shah, who is also an ER doctor, about the cases going up and if there's a link between the governor's stay-at-home order ending and Memorial Day crowds.
I would say yes. If when you open up, it's like letting your foot off the brake, and the virus does what it does. It goes viral. And it continues to infect people.
He says Arizona very well could hit hospital capacity. New data today shows Arizona breaking its own records for ICU beds and patients visiting the emergency room.
People should understand that what that means is that if you get into a bad car crash and there's not an ICU bed for you, then you would get truly suboptimal care. And the rate of death from all causes, including heart attacks and strokes and everything else for which you're critically ill and would need an ICU bed, would be threatened.
Despite the record-breaking numbers, the state has said all along it's about capacity. And they say Arizona has capacity with 400 ICU beds still available. We're told that the state does not need to activate St. Luke's at this time. But former Director of Emergency Management Wendy Smith-Reeve says it's important to know what the trigger point is.
The state has invested a lot of money to make that happen. So understanding what those thresholds are, what is the trigger point to open that facility, and more importantly, how are we going to staff it? Because if you cannot staff it, you can't open the doors.
A spokesperson for the health department tells me that they do have a vendor now to operate St. Luke's if it is needed. However, they did not provide more details at this time. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.
Nicole.